Day zero is the moment before company formation, when a founder decides to take the plunge, follow their dream, and commit to pursuing their vision of change. On day zero, you'll hear founders tell their story. From the initial idea, through reactions by critics and skeptics, setbacks and successes, we'll cover it all. Behind every company is a founder with ambition, goals, dreams, and wisdom to be shared. Let's explore them together.
Mental health illnesses are among the most common health conditions in the United States. According to the CDC, more than 50% of Americans will be diagnosed with a mental illness or disorder at some point in their life. Mental health care is becoming less stigmatized and more patients are seeking out the care they need. However, that presents a problem for healthcare, meeting the demand for mental health services. This episode is part 2 of our 2-part series on mental health. We compiled insights from leaders interviewed on both Day Zero and Her Story, discussing innovations in the mental health industry. Today's episode will feature Dana Udall, Ph.D., the Chief Clinical Officer for both Headspace Health and Ginger. We will also hear from Virna, Psy.D., Co-founder and Chief Operating Officer of Concert Health, and we will wrap up with Alison Darcy, the President and Founder of Woebot Health. To begin, let's hear from Dr. Udall.
I think a lot about prevention. And one of the things that has really changed over the course of my career is that we have gone from talking about diagnoses and treatment and sort of taking care of folks at one end of the spectrum to really thinking much more broadly, as you were saying, that everybody has some mental health struggle, some issue, some skill that they need to build. And so I think a lot of my thought and effort is really about how do we catch people early? How do we teach skills? And how do we make sure that those that are from more vulnerable or underrepresented groups are part of that conversation? So we are at such an important inflection point when it comes to mental health and DEIB. And I think the opportunity is really making sure that there is no one size fits all for treatment. So great that we're talking about empirically validated care, but what does that mean for particular individuals that are from groups that aren't traditionally studied, that are underrepresented, that speak different languages? There is a whole lot of work we need to continue to do to personalize care so that it's not just sort of a blanket like we use CBT. Well, that's great, but that may look really different in different individuals. Or, we know that for some cultural groups, talking with, let's say, a priest is much preferred. It's much more culturally congruent than seeking mental health services. So how do we catch people early and make sure that they have the resources in a way that really fits for their background and identity to get that support?
There is no one-size-fits-all for treatment. Mental health care can be made more effective by accounting for patient preferences and experiences. Next, let's hear from Dr. Little.
I think one is that, again, people often know their primary care provider, they trust them, and being a part of that clinical team is really helpful. I would also say one of the things that I love most about collaborative care is how flexible it is. Lots of models and lots of organizations will say they're patient-centered. But when you actually look, do the patients get to choose the cadence? Do the patients get to choose, what it looks like for them, how often they talk to someone, or what happens during those contacts? Do they get to choose the modality? Do they really get to take part actively in the treatment? And oftentimes the answer is no. And I think that, to me, what we bring to the table around that true patient-centeredness is incredibly helpful. I also think access, our ability to get someone into care within hours after that provider referral, we're at about 1.5 hours now. And I think someone needs care when they need care, and when they ask for care, and when they get identified. And oftentimes the access issue is really problematic. And if you're scheduling someone out a month or 6 weeks, or it takes time for them to figure out an app or to be able to engage, then you lose them. And I think our ability to engage people in care where they are in a very, very truly patient-centered way, and to really have the flexibility. Most of our patients we talk to multiple times in the first week, which is very different. And most patients really appreciate that kind of support.
A collaborative care model provides patients with greater access and coordination for their behavioral health services. To wrap up, we will hear from Alison Darcy.
So I was thinking about that narrative about replacement, and recently I was thinking like Woebot's like a bicycle and therapy is like the Formula One racing car. Like they're both transport, but they work in very different ways and they have very different, unique kind of strengths and limitations. And so one of the things that I knew from, working with people in Stanford was, and we know from the literature, is that the more work people do in between sessions, the better the outcomes were. And as a CBT therapist, when I was a CBT therapist, it was really hard to get people to do things between sessions. And like people would come with their wads of paper, hurriedly filled out in the weight room before they came in to see you. And it's sort of like, oh, that's missing the point, right? So we leave a lot of clinical value on the table. Whereas so Woebot is this like really great tool that enables people to engage in some of the skills that their therapist is teaching them. And it just works so beautifully where we've had engagements where we've seen, therapists refer their patients to Woebot, and they come back and say things like their patients come more ready, more engaged in therapy with them.
Woebot doesn't replace traditional mental health care, but rather complements it. It provides a way to scale up mental health services in a way that is still flexible for patients. Entrepreneurs are innovating the mental health care space, creating new tools and systems. The industry will continue to evolve over the next decade, and the companies that cater to patient preferences and lived experiences will have a competitive advantage. If you're interested in part 1 of this series about the state of mental health care perceptions and practice, head over to Her Story. And for more entrepreneurial insights, follow along with Day Zero.